Welcome, and thank you for joining today's webinar, Conducting and Using Hazard Vulnerability Analysis. This program is one of a series of resources developed for Rhode Island's long-term care, assisted living, and independent senior housing facilities as part of the Rhode Island Senior Resiliency Project. We will be reviewing one version of the hazard vulnerability analysis. You may wish to pause the webinar to get your facility's most recent HVA, either in print or electronic format. The Rhode Island Senior Resiliency Project is a statewide effort conducted by the Rhode Island Department of Health and supported with subject matter expertise from the Yale New Haven Health System Center for Emergency Preparedness and Disaster Response. The project was developed to assist long-term care facilities, assisted living residences, and independent senior housing facilities in your preparedness efforts in order to decrease the impact that severe weather can have on vulnerable populations who you serve, your staff, and your facility. The first phase of the project included the development and refinement of tools specifically designed to meet the unique needs of long-term care facilities, assisted living residences, and independent senior housing facilities. These tools were designed, tested, and improved with a smaller pilot group of Rhode Island facilities, and now the tools are ready to be utilized by facilities statewide. The goal of this training is to support long-term care, assisted living, and independent senior housing facilities in Rhode Island in conducting and using a hazard vulnerability analysis to reduce risk and increase overall organizational emergency preparedness. Upon completion of this course, participants will be able to conduct a hazard vulnerability analysis, interpret the results, identify and prioritize modifiable elements on hazard vulnerability analysis, and take action to increase preparedness and reduce risk. Does your facility already have a hazard vulnerability analysis and know how to conduct it? If so, this webinar is still for you. This presentation will not only briefly outline the HVA process, but will also go beyond basics to support you and your organization in critically examining your hazard vulnerability analysis results so you can be sure you are using your HVA results to your organization's best advantage. This program will take your organization beyond just checking the HVA boxes and support you in bringing your emergency preparedness program to the next level through effective and efficient use of the information that you might already have at your fingertips. With so many competing interests in the healthcare environment today, you may be regretting that you have to add examining your hazard vulnerability analysis to your to-do list. However, using your organization's HVA as a guide helps you to be more efficient and have a greater impact on resiliency. And HVA helps you and your organization work smarter, not harder. Your efforts should help you be more focused on events that are most likely to occur, events that are most likely to impact your facility, and areas where your efforts are more likely to result in a decrease to your facility's risks. Is it really worth it to take a second look at your organization's hazard vulnerability analysis? Take a moment to answer the following questions. Have we picked all the low-hanging fruit to reduce our organizational risk? Are we utilizing our limited resources wisely by focusing on high-risk or frequent events? Are we prioritizing preparedness activities informed by facts, not perceptions, about our vulnerabilities? Are we looking at the big picture, the whole library of events that we are vulnerable to, and not just focusing on certain ones? Have we worked to lower our risk in areas where our efforts will have the most impact? A review of your organization's hazard vulnerability analysis will answer these questions and more. Today's agenda will begin with the basics of conducting a hazard vulnerability analysis, commonly abbreviated as an HVA. Then guide learners in interpreting the results of the HVA. Next, we'll discuss taking action based on HVA results, and we'll close with information to help organizations maintain their HVA in the future. Let's begin now with information to support organizations in conducting an HVA. What is an HVA? An HVA is a written or electronic tool that helps an organization identify the events the organization is vulnerable to, allowing the organization to direct their efforts to address those events. An HVA uses best available information to evaluate the risk of various hazards to an organization. If your organization already utilizes an HVA tool, take out the tool now or pause this webinar to obtain it. If your organization does not yet have an HVA or would like to use a version you see in this webinar, you can get one without cost from the Rhode Island Department of Health. Just email them at doh.climate@health.ri.gov. The advantages of a tool such as the HVA is that it is in a clear, easy-to-use Excel format that calculates all necessary equations automatically through pre-programmed formulas. It is easy to update, includes a comprehensive multi-tab events list, a summary tab, and summary graphics that automatically generate based on the user's inputs. If you currently have a different version of the HVA, you may be able to easily transfer your numbers to the new format. Click on the Excel worksheet tabs to see the 4 categories of hazards covered: natural, technological, human, and hazardous materials. Naturally occurring events include geological and climate-related events. Technological hazards include a variety of utility-related failures. Human hazards are events caused by people, and the hazardous materials events category includes events related to chemical and radiological hazards. Click through your HVA and review the types of events that fall under each category. For each event, a facility evaluates the risk of that event by considering, as noted in the headings, the severity-related columns include probability, or the likelihood of an event occurring; human impact, the possibility of death or injury if that event occurred; property impact, the physical loss or damages resulting if that event occurred; business impact, or the interruption of services your organization would experience if that event occurred. The following columns are related to mitigation by reviewing how well your facility is prepared. These include preparedness, or how prepared your organization is to respond to this event; internal response, or the internal resources your organization currently has to respond to the event; and external response, or the external support your organization currently has to respond to this event. The right-hand column is a tally of all the other columns. This column indicates the overall threat of each of the risks. In HVA, ask the user to score the probability, severity, and preparedness for each type of event. Issues to consider for probability include, but are not limited to, known risk, historical data, and manufacturer vendor statistics. Issues to consider for human impact include, but are not limited to, the potential for staff death or injury and the potential for patient injury or death. Issues to consider for property impact include, but are not limited to, the cost to replace, the cost to set up temporary replacement, and the cost to repair. Issues to consider for business impact can include business interruption, employees unable to get to work, customers unable to reach the facility, company in violation of contractual agreements, imposition of fines and penalties or legal costs, and interruption of critical supplies. Some of the issues to consider for preparedness include the status of current plans, training status, insurance, and availability of backup systems. Issues to consider for internal resources include, but are not limited to, the types of supplies on hand, the volume of supplies on hand, and staff availability. Some of the issues to consider for external resources include the types of agreements with community agencies, coordination with local and state agencies, coordination with proximal healthcare facilities, and coordination with specific treatment facilities. Based upon the user's inputs, the HVA calculates probability times severity mitigated by preparedness efforts to determine risk. For example, multiplying the likelihood a blizzard will occur at an organization times the impact of the blizzard on the organization minus the mitigation efforts that were taken, including plans and supplies, staff response, and external response, results in the risk of a blizzard to that organization. Let's run through the process for one event in the naturally occurring hazard section, a hurricane, for a fictitious Rhode Island long-term care facility in Providence. Based on the factors just described, we'll rate the probability of a hurricane in Providence as moderate and enter a 3, since hurricanes are a meteorological phenomenon that have historically impacted Rhode Island with regular frequency. We'll rate the potential for human impact from a hurricane as low, a 1, because injury and death should not be as likely. However, the property impact for a fictitious old coastal facility will rate as a 2, moderate, knowing our facility is vulnerable to physical losses and damages. With a hurricane impacting roads, deliveries, and utilities, and possibly requiring evacuation from our facility, we'll rate business impact as high, a 3, expecting major interruption of services. Regarding preparedness, weather reports allow for notice of an impending hurricane. So with ample time to prepare and our fictitious facility's extensive existing preparedness efforts, we'll rate our preparedness as high, a 1. We'll rate our internal response as a moderate, 2, due to staff travel limitations and storage limitations. And we'll rate the external response as moderate, a 2, assuming external resources will be overwhelmed with requests for assistance throughout the affected area. The HVA tool utilizes the inputs we provided to determine a risk or relative threat for our facility from a hurricane as 61%. Now that we understand the HVA process, let's learn more about how to interpret an HVA once your organization has completed the process. First, examine the risk column to find the events that your organization is most vulnerable to. Risks of 40% and above stand out to most organizations. Identify these high-risk hazards from your HVA and focus your preparedness efforts on these events. They're your facility's vulnerabilities, and you can direct your time, efforts, and budget towards them in order to lower your organizational risk. Make sure everyone at your organization is clear on what your facility's priority issues or greatest risks are. Your HVA will help you to do this. Your actual risk may be different than what you, your staff, or senior leadership believe. You may be able to use the HVA to clear up misconceptions. For example, the organization may want to prepare for a highly publicized event such as terrorism, but the highest risk for your facility may be something more mundane, like a severe weather event. You can share the results of your HVA to explain why you were doing what you were doing. Now that your facility knows what your greatest risks are, take that list of hazards and begin to take action to reduce your risk to protect patients, residents, staff, your facility, and your organization as a whole. Recall that our fictitious hurricane gave us a risk of 61%. This is too high, and we would need to prioritize ways to reduce our risk. For each identified high-risk hazard, work to reduce your risk level by focusing on your modifiable areas, which are the areas your organization can make changes to that will result in decreased risk. The easiest modifiable areas are the green columns of your HVA: preparedness, internal response, and external response. Improving your scores in these sections will reduce the overall risk. To impact the modifiable areas of preparedness and internal response, consider the following possible actions. Develop policies and procedures to mitigate or respond to a threat, and regularly review these procedures and train and test staff after each policy change. Conduct comprehensive staff training and regular retraining. Hold drills or exercises to test your response capabilities and identify areas of improvement, and determine what additional resources, equipment, or redundancies may be needed. If policies and procedures are adequate, revise training sessions. If policies and procedures need improvement, make changes and then modify training. Staff training should include staff members' roles and responsibilities during an event, understanding the organization's response, resources and equipment used in the response, supporting staff as they develop their own family's emergency preparedness plans. For drills and exercises, develop a progressive series of activities to enhance learning to test the operational aspects of policies and procedures, workshops, tabletops, drills, functional exercises, and full-scale exercises. Evaluate results from training sessions and exercises to determine strengths and weaknesses in planning, resources, and training. Develop after-action reports and plans of correction following each activity. Some examples of resources and equipment to improve preparedness are an evacuation chair during elevator failure, fire extinguishers for small, contained fires, VPN for off-site access to computer-based files, spill kits for chemical spills such as formaldehyde, eye wash station, generator, HVAC shutdown for harmful environmental conditions. Also consider your other sites and staffing as internal partners, if applicable. To impact external response, consider contracting with better suppliers and repairmen, increasing involvement in community coalitions, developing MOUs and MOAs with partners, reducing reliance on external entities, evaluating internal utilities. As you evaluate the responsiveness of municipal services, consider, are streets plowed in a timely fashion? Do police, fire, and EMS respond quickly? Do you frequently lose electric service for long periods? As you evaluate contractual services, consider, is your landlord responsive to issues? Would your plumbers, electricians, HVAC specialists, and others respond quickly? Less modifiable are the areas of human, property, and business impact. We can't fix Mother Nature or limit the number of hurricanes that visit Rhode Island. Human impact can only be modified by the individuals in the communities. Evacuating early to a safe location is one method of individuals reducing their personal risk. We can look at our building structure and may be able to upgrade or modify some of the features. For example, replacing windows with ones that have a higher wind rating or improving drainage around the building. Changing the impact a storm will have on our business might be accomplished by improving our backup data, being able to contact patients from an off-site location, and maintaining a method of communicating with our patients, staff, and providers. To decrease risk for natural hazards, in addition to policy updates, increased planning, staff training, drills, and partnerships, also consider building enhancement, resource procurement, development of agreements for assistance, and further collaboration with local and regional response partners. When considering decreasing risks for hazardous materials events, actions to consider include development of agreements for assistance, contacting experts for guidance, and identifying further mitigation efforts such as safety enhancements, training needs, and resource procurement. When working to decrease risk for technological hazards, actions to consider include identify backup systems in the event of technological failure, conduct further training of staff to recognize, mitigate, or correct problems in the absence of vendors, identify mitigation steps such as regular maintenance and checks of systems, and ensure continued collaboration and planning with vendors to decrease response and downtime. To decrease risk for human hazards, actions to consider include ensuring your organization's ability to recognize possible threats early, conduct further drills and exercises to orient staff to their roles and responsibilities, and consider security enhancements to the facility. Our final topic is addressing the maintenance of your organization's HVA into the future. Your HVA is a living, changing document. Review your HVA annually as part of a comprehensive emergency preparedness program. When you make any changes discussed today that improve your preparedness, internal response, or external response after an actual event, or if available information changes regarding probability, human impact, or business impact. Examples of changes in best available information include revisions from the experts in the field regarding probability of natural events in your area, structural changes at your facility, changes in the companies that serve your facility, such as utilities, vendors, IT systems, security systems, and the national or international issues that might trickle down to your community, such as pandemic events or other hazmat or terrorist events. When reviewing your HVA, be sure you have the right group at the table. A multidisciplinary group is required to conduct or review your HVA, representing areas including facilities, environmental services, human resources, management, clinical management, staff training, security, and emergency preparedness. Consult with community partners or subject matter experts for assistance or collaboration. Be honest or even a little bit harsh. It may be better to ascribe a higher risk to a hazard and then work to better prepare for the hazard than to be lenient and not bother working on it at all. Remember, your HVA is a living document that will change as the organization, community, nation, and world changes. Conducting an HVA allows your organization to determine the risks for the hazards considering probability, human impact, property impact, business impact, preparedness, internal response and external response, or the external support your organization currently has to respond to this event. Organizations can interpret their HVA results to guide their emergency preparedness program and identify high-risk hazards. Organizations can take action to increase preparedness and reduce risk by impacting modifiable elements and continually revise your HVA as part of your organization's comprehensive emergency preparedness program. If you have additional questions about any of the tools presented today or about the Rhode Island Senior Resiliency Project, please contact them at doh.climate@health.ri.gov or call them or visit the website shown on the screen. Thank you very much for your participation in today's webinar and the Senior Resiliency Project. On behalf of the Rhode Island Department of Health and also on behalf of the Rhode Island long-term care residents and their families, thank you for all you do each day to protect the health and safety of the residents of Rhode Island.